Welcome back. It's Dr. Jennifer Browning, better known as DocJenFit, and we're talking about your TMJ. Now, this is a joint that everyone has, but the disorder TMD is very common where you get a lot of discomfort around your jaw, and maybe it's even radiating into your head or down your neck, or maybe you're hearing a lot of clicking and that's bothering you a ton. If noises are not met with any pain or discomfort when you're eating or you're doing anything in your everyday life, it's not really anything we need to pay attention to. But if it's bothering you, then it's something we can start to work on. So I'm going to take you through a few exercises to help to reduce some tension and pressure in this area. But we also have a podcast on this where we go into a lot more detail on what TMD is, how it comes about, and what other resources you can use to start to address it. So we'll link that up as well if you want to listen to the full podcast and get a better understanding of what this is and what else you can do. So primarily when we're talking about reducing tension, I mean, you can always start to massage the muscles around the jaw. That's great. But in order to reduce the tension overall, we want to address our breath because sometimes our breath is what's driving the tension up into our neck, our chest, and our jaw area. So if I'm always breathing in this more shallow chest where I'm lifting and elevating my shoulders, I'm using more of my accessory muscles and I'm more prone to be in a little bit more stressful state, which puts more tension throughout my entire body. So especially if you know that you clench your teeth at night, you are grinding a lot, or you hold a lot of tension in your jaw in general, or you've been told from the dentist maybe that they're seeing a little bit of grinding or clenching in your teeth, well, then this is going to be a really good place to start. So this is our breath. We want to focus rather than getting into this chest breathing, we want to put our hands on our low rib cage and learn how to breathe from the sides of our rib cage. So I want you to place your hands on your rib cage. If you don't feel comfortable here, maybe some shoulder restrictions, you can always hug your ribs this way. Okay. But feeling on those lower rib cage, so not too low, we want to feel those ribs. Okay. Take a breath into the sides of your hands. This is really important to do in front of a mirror, especially because you want to see, do my neck muscles turn on right away? Or do I see my shoulders elevate as I try to breathe in? The goal here is to breathe into your hands and trying to relax and reduce any tension and pressure coming up here. So relax your jaw, unclench your teeth, close your mouth. And we're going to try to just breathe from your nose. So when I say close your mouth, that doesn't mean close your teeth. Just means close your lips. Okay. You're going to breathe in from your nose. Breathe out from your nose. So especially when we do nasal breathing, we're helping to improve the nitric oxide, getting that into our bloodstream, which helps to vasodilate those blood vessels to help us just relax our body even more and get more oxygen into our muscles as well. So we're helping to down regulate our system, reduce that tension. A lot of us don't realize how much we clench our jaws throughout the day or night without thinking about it. So this is a really important place to come back to, is starting with that breath. Okay. Now some exercises that you can start to do. One of my favorites are just relearning how to use that jaw pressure. So you're going to actually place your tongue at the roof of your mouth. You're going to stick it up at the roof of your mouth. So what you're going to do with the tongue at the roof of your mouth, you're going to try to, keeping a straight line, drop that chin straight down and straight up while the tongue stays up there. So it's going to look like this. And obviously, I don't know if I stayed in a straight line because I don't have a mirror directly in front of me, but hopefully you start to notice, does your jaw shift toward one side or the other? So this is a good way. You're only opening as far as you can, keeping that tongue straight up at the roof of your mouth with the control of keeping it in a straight line. Now, the next one you can do is trying to keep that tongue up, separate your mouth, and you're going to shift the jaw side to side. So tongue up, And again, you're going nice, slow, and controlled. So you're trying not to have any clicking happening. You might need to close a little bit more. You might need to open a little bit more. You might need to reduce the range of motion. And really watch, as I shift side to side, is it staying in a straight line? So that's what you're trying to do, is stay in that straight line. The last one you can do is trying to shift that jaw forward and backwards. So that's improving the stability and the control of that jaw. That's something that you're going to want to work on a daily basis, especially if you're noticing some patterns that just aren't working very well, or you feel a lack of control that you're noticing in the mirror, like, oh, wow, I don't have a good straight line when I'm doing those. Okay. So that's a good way to work on it. Then starting to reduce or improve the pressure and the strength that we have in the front of the neck and reduce the tension in the back. So we want to realign kind of where that neck rests on our body. So we're going to do some chin tucks. Now, I love doing chin tucks on your back to kind of learn. Now, I know I have a ponytail kind of in the way, so you're just going to have to go with me and listen here. So what you want to think about with the chin tuck is as the chin comes down, the top of the head is going to come up and forward. Okay, so it's almost like your eyes are trying to look at your knees. So without even lifting the head first, you want to see, can I get that chin down and back? Top of the head up and forward, almost as if I'm going to look out toward my knees, and can I hold it there? And then if you feel comfortable and if you don't have a lot of pain around the jaw, again, unclench those teeth, make sure they're not together. You're just going to slightly lift the head as if, and it's hard for me to do that when I'm talking, but you want to think of that chin still going down and back, head coming up and forward here. And then as you lift, it's like you can barely get a finger underneath your head. So it's going to look like this. And that's going to put a lot of tension here, but it's going to start to build that strength in the front of the neck. And I'm telling you, if you just did like 10 seconds and you did it 5 times, 10 times, you're going to sit up and feel a huge difference of already how much that head just naturally starts to stay over the body without it coming too far forward or creating a lot of tension and pressure into that jaw. And then last thing that I want you to think about is opening up the rotation and the flexion and extension of that upper back. So when we improve the mobility of our upper back, then the head already has a better place as to where it can rest. Because if the upper back is getting really stiff and forward, well, then the head is going to come forward. It's going to cause a lot of tension and pressure to start to build up into that neck just from having more of that rounding in that upper back. So if we can improve the rotation, the flexion, extension, and the mobility of that upper back, well, then as my upper back starts to get more mobile, my head naturally starts to rest better over my body without me forcing anything. So it's really crucial to work on that upper back mobility. So one that I'm going to show you that you can do when you're working at a desk throughout your day, just anytime, you can come and you can round down, lift your arms, and lift that chest up to the ceiling, pulling those shoulder blades back, breathing out. Breathing in, open that pressure in through that back, and breathing out. Oh, that one feels so good. Even just doing a couple, it helps to open up that body and feel a little bit of tension release. So hopefully all of those are things that you can add into your day to help to take a little pain and tension off of that TMJ. Don't forget, if you love what you're learning, I have so much more in stock for you. So hit that subscribe button, check out the other videos I've done in the past, and leave any comments of any suggestions that you have for videos in the future. And I can't wait to help you feel incredible and amazing within your body.